Okay, let's see.
It's a fascinating phenomenon, but it is not well understood. In fact, we don't even know what causes ordinary identical twins.
The contrast between their experience and that of normal identical twins provides insight into the origins of life.
The conjoined twins that we've known of so far have very, very different personalities, and I think this quite surprising most people because they share such a common environment. They really end up being very similar, and of course they share different backgrounds, but when two people find themselves in such close quarters, there's probably a real pressing need to differentiate and develop their own identities.
Chang died of cerebral clot in 1874 at the age of 63. M died an hour later. Separating joined twins has only recently been proven, and we have meditated on also. The ancient the internal structures of the body were first explored, but only by examining the hacked-up bodies of fallen worlds. He visited Greeks refused to define the corpse. Public displays of the world of Venus were not pioneered until the 18th century Enlightenment. The era of scientific thought that produced places like the College of Physicians of Philadelphia and its Museum of Anatomy. Around the same time in Paris, a cousin to the British Museum was established by French anatomist Honoré Fragonard. And like the Museum, it's still a valuable resource for medical students today. Fragonard's methods of dissection and preservation were ahead of their time. And his vivid displays of the new materials standardized around the same time, the cousin built an exhibit of incredible displays of his illustrations of Fragonard's methods of preservation traditional form of Chinese is on a revival in recent decades.
Doctors in the 19th century were very well acquainted with acupuncture, pressure, surprisingly, because we think we rediscovered the medicine in China. But it was in all the textbooks. There was always a great deal of interest in medicine. That's what the 18th century acupuncture figure, needles very much alluring.
The jury's out on what it can do and how effective it is. The 18th century understanding of acupuncture is the same as today.
The theory is there's a term called chi in Japanese and Sanskrit, and it's a vital energy that is in all of us and in everything. And through the meridian system, we can use it.
But Even the Western medicine of earlier times was plagued with new ideas. This self-enema device comes from the mid-1800s, representing a practice still done today, but not sanctioned by most physicians. This device was a lobotomy tool.
Lobotomies actually earned Dr. Evacuanita's Nobel Prize because it was a way of relieving mental symptoms that nothing else could touch. And they destroyed certain areas of the brain. You could change the personalities. Well, some with severe mental disabilities are no longer depressed or agitated.
But this dangerous technique is no longer used today. This sulfite was called a lancet, and it was used to perform this. It was believed that bleeding a patient would restore a balance of fluids to life. It came complete with its own bleeding. This is another technique now rejected by modern medicine. It was something rather like this that killed George Washington, who some claim was bled to death when he fell with a foot infection. Cupping, a variation on bleeding, was a popular cure-all 200 years ago. This hook came complete with a hand pump to bring the blood to the surface, and a spring-loaded wrist slasher. A suction cup would then draw out the blood. The process of wrist cupping was mechanized with this device to make it easier and safer for the user. It employed a set of blades that were spring-loaded and released with the press of a trigger. It's ironic. A medical technique that is today considered harmful was once regarded as helpful. But because of research at places like the liver, medicine has advanced beyond such remedies. While a lot of them like toy devices, these dental instruments, much like those used today, go back to the mid-teens. And they were used with etheric oxide, the earliest use of anesthetics in medicine. Tools like this extractor made the dentist's life easier, and still easier. This violet wrapper, around 1910, produced heating in the muscle. Some claimed it would cure all kinds of disease. They were wrong. Only one new effect.
One effect of the membrane is that it generates ozone around the vacuum tube, and ozone effect is silent. So barbers often used it on their clients after they would shave them, and it would destroy the kind of bacteria that would cause problems in the face.
The Mutter section of early microscopes represents the beginning of a more enlightened era in medicine, when observation and experimentation would guide medical advancement. One of the earliest microscopes was a pinhole viewer used by Anthony van Leeuwenhoek around 1670. Van Leeuwenhoek, Dutch maintenance man at a police station. He became fascinated with the new invention and was the first to observe red blood cells, bacteria, and yeast in the viewer. He was also the first to use the assembly technique, and his work led to the civil yet revolutionary that germs cause disease. Technology seen by Jules Verne in Robinson's his iron lung was a state-of-the-art laboratory.
To ventilate the individual to help them breathe through positive, negative pressure applied on the rib cage, and simply force of air pressure that breathes for him. And in polio, other acute respiratory problems, the rib cage muscles can be paralyzed. Some people spend their lives in function.
The museum's diverse collection of historic inventions and medical anomalies has inspired effective tools and forms of illness. But what sets the Mutter's exhibits apart from most others is the display of medical conditions that science has yet to come. As the Greek god of health, Aesculapius lords over the knowledge of his children and is every member of a human profession. He is a reminder of that elusive idea that is relentlessly pursued for medical attainment. In order for physicians to grow and expand their understanding of this
Use of the term runs a little more to the fact that this muscle is a large defect as opposed to a minor defect.
Some have resulted outside agents, like this leg cast of an elephantiasis victim. caused by the thalamic line in the immune system. Others are examples of cancerous tumors left untreated. These fetal skeletons illustrate the normal stages of prenatal development and serve as a contrast to those with congenital abnormality.
We also have a fairly large collection of conjoined twins, showing various ways you can be conjoined with having a single-headed body or having two heads and a single body.
These specimens are of great value to medical students who never see such examples in a lab or teaching hospital. These dicephalic twins, born in Ohio in 1870, share a single umbilical cord, and like the Siamese, have different dorsal root lines. Likewise, these cephalothoracopagus twins, born in 1851, did not know at their birth. Most victims of such deformities do. Abnormal growth, like this one that grew outside the skull, show the other forms that birth defects may take. Other abnormalities won't immediately life-threatening, but they will excrete rapidly. This human colon weighs 47 pounds. It's a form of Hirschsprung's disease, a problem with the nerve supply bone's muscle areas. It belonged to a 29-year-old man who spent a decade in a Philadelphia museum, presenting himself as the beginning. He was 5.5 feet tall, but his colon exceeds 7 feet. It would not be surprising that just before his death, he consulted a doctor complaining of constipation. We were extremes of every kind of being. The skeletons of a male giant, a dwarf woman, and a body are on hand for comparison. The dwarf woman, 3 feet high, is accompanied by a skeleton child who had to be a cesarean section. The giant is 7'6" inches. It's an example of what growth hormones do when the endocrine system malfunctions. The rib cage is misshapen because the man's extraordinary sum weight caused a deformation in the skeletal tissue, a common side effect of growth. The museum demonstrates the strange things nature has done. It also displays the results of what man can do to himself. The practice of foot buffing, once considered stylish, is shown by this model and by an actual buffalo to have criticized. Other exhibits are of man-made deformities inflicted in the heat of battle.
We have a collection of casualties from World War I. The Naval Base Hospital No. 10, which is in Le Trèfort, France, showed the effects of different types of shrapnel and bullets on the bones of the individuals.
But perhaps the first examples of man's alteration of himself are the shrunken heads created by the Hebrew tribes of Ecuador and Peru.
We have two shrunken heads in our collection. One is a genuine Ibero sunset from Ecuador, which means to the Indians, they're the Ibero Indians, prepared it as a part of their religious rituals. The other one is one we suspect is made of history. This is a shrunken head, but attempt to make it look in proportion by cutting the hair, by leaving the face. This is not typical of the way the Iberos prepare their skulls.
The reason for head shrinking was that the Hebrew was in. By shrinking, going up the head of an enemy, the soul was trapped, preventing it from joining its kinsman in the afterlife. The head shrinking procedure is very precise. A victim would be cut along the back and peeled off the skull. The skin would be immersed in hot water until it shrank to 2/3 its normal size. The eyes and lips were then sewn, and hot stones or sand were poured into the head cavity to fill it. Finally, it was smoked over a fire to preserve it. It could take many hours to complete the process. These specimens are a vivid documentation of the deep understanding of the body and of the wound. Like the Condon Medical Museum in Bangkok, Thailand, is also aimed primarily at medical students, though the general public also finds it fascinating. The exhibits upon the museum will vary reactions. And it's also generated controversy. Displays like these cross-sections preserve the inner critic and the students on features to examine the intricacy of the brain structure that can almost be ambition. Here, a new nervous system has been painstakingly teased out of body for stunting oscillation. These are actual nerve fibers, not applications. An organic parallel to the motors in the brain. The condom also has cadavers for dissected, with sections peeled back to reveal tissue layers with a level of detail far exceeding any textbook. Museums that look as of the past to serve the doctors of the future are what the movement helped to invent. And this educational vision continues today, with exhibits like Harry, example of a rare condition in which the soft connected tissues develop.
Makes it important is that partly the breakthrough research being done at the University of Pennsylvania elsewhere that is focusing on the cause and the possible cure of this disease. Harry is the best documented skeletal disorder in the world.
Understanding this is what the museum and its vivid array of exhibits is all about. As more displays are added, the museum continues its role as a educational tool for law students, medical historians, and the general public. In the 21st century, take for granted that medical science can tackle and eventually conquer every threat to human health and long life. Optimism has been enshrined in the museum from its humble beginnings. The belief that medicine is also working hard. And the rigorous importance to medical research continues to grow, as it has throughout.
When it first was organized, it was probably the least important of the museum's country. What is interesting is that we're still here, whereas many of the university medical museums have long since been disbanded and put in stores because they should be relevant to the needs of different medical students.
There is no good substitute for the real thing, and the Museum is a museum of the real thing.
From forgotten truth and iteration on the wrong side to test the bald spots
Perfect link around now.
and metal deadly close to a magnet. Working my list of 25 shocking medical mistakes.
It's happening every year in every hospital in the country that we're just not catching.
It's the third leading cause death in this country.
For the most part, we're silent on it.
What you can do to not become a victim.
I'm Elizabeth Keller. I'll show you how to become an empowered patient.
With the help of world-renowned patient safety expert Dr. Peter Parnavos, American Cancer Society Chief Medical Officer Dr. Raleigh, acclaimed medical fiction author Dr. Abraham Verghese, and more. Stay tuned. This hour could save your life. At number 5, baby security breach. The woman in this surveillance video, Jennifer Latham, tells her family she's expecting a baby when really she isn't. So she decides to want one. Take a look as she changes nursing scrubs, enters the baby, comes out with a bag under her arm, up in the bag. The nurse actually gets off the child, despite the baby. The baby is mom, for almost 2.5 hours. Spots the getaway car and pulls the baby snatcher over. Listen as her lies to the occupant of the car. This car isn't buying it. Jennifer Lake rescued. He's returned safely back to mom and dad by ambulance.
What kind of person is there? Most people who steal babies actually want that themselves. And hospitals are a great place to get babies.
Since 1983, 32 babies have been abducted from U.S. healthcare facilities. Make sure your eyes or nurse's eyes are on your baby at all time hospital, because every so often, a baby snatcher is eyeing them too. At number 24, fake doctors.
I'm not a doctor. I never went to medical school.
Like Amy Adams' character in Catch Me If You Can, Tammy Pertine thinks she marries a physician.
Every morning I would drop him off at the hospital.
Until her husband, Eric, pleads guilty to impersonating one.
I was told that at the time he was arrested, he and a nurse were taking a patient from the emergency room into the intensive care unit.
The hospital says he escapes notice by wearing scrubs and a real doctor's ID badge.
Anyone who fakes being a medical doctor is fundamentally a con artist or a scammer. Incredible that these things have been made.
This man, Arthur Coates, also turns out not to be a doctor.
He advertised extensively on websites saying that he could straighten out his crooked spine.
Serafina Gurley sees the ads. She thinks Coates is a doctor who can correct her scoliosis. She wears Coates' brace for 6 months, and her curves get even worse.
Extremely worse. Extremely. The people who will fall for these fake doctors usually are extremely vulnerable. It is that ability to gain a patient's trust, that respect, that white coat, and that ability to smile and get person talking and trust them that allows the fraud to continue.
The Federation of State Medical Boards lists hundreds of imposters who masqueraded as doctors in America.
It's Mace.
Unless it's Leonardo DiCaprio examining you, go online and if your doctor is a licensed physician in your state. At number 23, treating the wrong patient. Carrie Higuera is bleeding 3 months into her pregnancy. She fears she's about to lose her unborn baby to a miscarriage. She's waiting in a hospital room when a nurse comes in and asks if her name is. She says yes and follows the nurse to a CT scan room. The nurse tells Carrie a doctor wants a scan of her abdomen and they give her the scan, even though Carrie is 3 months pregnant.
If you're radiating the abdomen, by definition, the baby is going to be in the field of radiation, the baby is going to grow.
That CT scan is a mistake. The hospital has confused Carrie with another patient named Carrie.
The scan in the pregnant woman will increase the risk that that child will get leukemia. At that early stage, the fetus is also at risk of getting birth defects.
Fortunately, Carrie's son Nathan is doing just fine.
That would confuse patients. It often happens with people who have similar names. So especially for common names. Jane Smith, there may be 2 or 3 Jane Smiths on a common hospital floor.
Before every procedure in the hospital, make sure the staff checks your name, your date of birth, and the barcode on your wristband. At number 22, pharmacy faux pas. Marina Silva is 6 weeks pregnant. She picks up a prescription for antibiotics at the pharmacy. She takes the medicine and then sees the label is wrong.
Came back to me, looked at the bottle, and it wasn't my name.
The pharmacy has given Marina a prescription meant for another woman who has the same last name and a similar first name. The medicine isn't an antibiotic. It's actually methotrexate, a drug that has the potential to terminate pregnancies.
You never ever want to give a drug like that to pregnant patients.
This is my first child, so it's really difficult to deal with. Maybe we can have to booking. There's a lot that goes with it.
Things get hectic behind that prescription counter, and the onslaught of phones ringing, messages, patients coming in, pharmacists pull medications from the shelves. The wrong drug, the wrong strength. We'll deal with a dangerous situation. We don't want to take the wrong medication.
At neighborhood pharmacies every year, 30 million prescriptions are dispensed improperly. When you're at the pharmacy, open the package and show the medicine to the pharmacist to make sure it's right, and make sure your name is on the label. At number 21, botched plastic surgery. Marilyn Lease wants to look a little younger, but after eyelid surgery, she's unable to fully close her eyes.
That's how it is every day, 24/7, 365 days a year.
Living with the mistake is bad enough.
Can you die from plastic surgery?
Oh, absolutely. It's possible to die from plastic surgery. We've seen it happen.
Take the case of this beauty queen. Argentinian model Solange Montano wants a bigger butt. Why would a woman want a bigger butt?
There are men out there who like big butts. We're a culture that like that's what makes us feel more attractive than a bigger butt.
The beauty queen goes in for the operation and then dies 5 days later. Here's where some experts think the surgery goes wrong. Whatever doctors inject into her butt to make it bigger, fat, silicone, or something else, a piece of it breaks off, tears through the bloodstream, then lodges in her lungs. Without blood flow to her lungs, Solange strangles. Death is a crazy price to pay for beauty, so make sure your surgeon is certified by the American Board of Plastic Surgery. At number 20, dosage disasters. Movie star Dennis Quaid's twins, Thomas and Zoe, develop an infection a few days after they're born. The Quaids take the babies to the hospital for a course of antibiotics. A blood thinner called heparin is used to prepare their IVs.
When you have an IV, there's a very, very, very dilute dose that they'll put a minuscule amount in the IV so that the IV doesn't clot up.
When the babies get the IV, their blood unexpectedly turns thin and watery.
Doctors trying to climb up bleeding, and then if it doesn't have T-boots and don't report blood spread 6 feet across the bleeding splatter and the wall.
Doctors realize someone is giving the babies a massive overdose of heparin, 1,000 times more than it's supposed to be.
They didn't notice that it was the wrong dose.
Here's how that overdose happens.
The adult dose was in a dark blue line. The pediatric dose was in a light line.
A technician accidentally puts the adult dose of heparin in the location where the children's dose is usually stored. Then a nurse grabs the bottle without checking it.
Our babies could have died that night.
Thankfully, doctors managed to control the bleeding, and the twins make a full recovery. Workers stocking medication drawers make mistakes about 4% of the time. When you're in the hospital, ask for a daily list of medications and dosages and check them when they arrive. Ahead on my list, you won't believe where this patient ends up after brain surgery. And tools left and forgotten in the worst place possible. We've already seen some bad medicine, counting down our 25 shocking medical mistakes. Dosage disasters came in at number 20. At number 19, toxic transplants. Joshua Hightower needs a new kidney. He's on a list waiting his turn for the life-saving organ. A potential donor dies. Joshua gets one of the man's kidneys, and then suddenly, instead of getting better, he gets sicker.
He was throwing up, headaches, had shakes real bad, sleeping a lot.
Within months, Joshua is dead at age 18. A doctor tells his mother he died of rabies.
And I said, what do you mean rabies? Like some foreign branch rabies or some kind that was, uncommon? And I said, or the kind that you vaccinate your dog every year for. And he said, you kind of vaccinate your dog every year for.
And just how does this teenager get rabies, a virus that's spread by animals? That new kidney he gets is infected with rabies before it even gets inside his body. Here's what happens. The organ donor has been bitten by a rat, but no one knows it. The virus spreads through the bloodstream.
No one suspected that this person had rabies. All the organs were transplanted, and all the recipients contracted rabies.
Only later did doctors realize the donor had all the symptoms of rabies from the beginning, and they never should have used his organs.
There's thousands and thousands of potential pathogens out there that organ donors could be infected with. Rabies is so on. Screening tests for rabies are not universally available.
In the U.S., more than 100 people have been victims of similar toxic trends. After a transplant, if you get sicker instead of better, ask if the other recipients from the same donor are also sick. Early treatment could save your life. At number 18, dumb discharge. James Axton undergoes brain surgery. He goes back to the hospital for more testing. His staples are still fresh in his head when the staff pack him off alone in a taxi cab.
Most patients who have been discharged from the hospital should not be going alone in a taxi.
James is so disoriented, he doesn't know his own address.
He was confused.
Strangers find him asking for help after the taxi drops him off in an unfamiliar neighborhood.
He was in a hospital gown, and when he saw us, it was wet, rain, pulled out. He had bandages and staples in his head still from the surgeries.
These good Samaritans help James get home after his careless release. A lot of people feel woozy when they leave the hospital, so make sure you have a ride home from someone who knows where you live. At number 17, ambulance errors. A lot can go wrong on the way to the hospital. Darlene Dukes is struggling to breathe. She calls 911 and tells the operator where she is. Instead of dispatching an ambulance to Wales Drive, the dispatcher sends paramedics to Wells Street, WELLS, 27 miles away from Darlene. Darlene dies from a blood clot, police say, after an ambulance takes more than 45 minutes to find her.
Very critical amount of time in terms of the response time necessary to what.
When you call 911, slowly say and spell out the name of the stewardess. At number 16, patients. Nursing home patient Mary Cole turns up missing during a bed check. Finding her becomes a manhunt. Noted on her missing person poster, she suffers from Alzheimer's disease and may be disoriented. Her daughter, Tammy Terry, clings to hope and joins the search.
We're up in the morning until we stop.
4 days go by until Mary is finally found inside the nursing home, locked in a storage closet.
I'll be impressed with them when they said we searched every room, every nook and cranny, we moved furniture, and it was a lot.
Mary is severely dehydrated and dies soon after. The family's lawyer says Mary wandered into that closet and got trapped. My mom suffered for 4 days. And there's no excuse for it. 1 in 5 nursing home patients is prone to wandering. If your loved one sometimes wanders, consider getting them a GPS bracelet that tracks their every move. At number 15, surgical souvenirs. Nelson Baker comes out of surgery with a sponge left in his abdomen, a foot long by a foot long.
When they opened me up, the medical shows it was rotting. It created perforations in my intestines.
Here's how a sponge can get left behind by mistake.
There's often blood, there's tissue, very difficult to see, and sometimes sponges are tucked under an organ inside you that they're not in clear view, but they're soaking up some fluid or blood.
Take a look at this similar mistake. That's a 6-inch clamp, and this is a 13-inch retractor. Nurses are supposed to keep track of how many tools go inside you and make sure the same number come out.
Sometimes the initial count going in is wrong, the count going out is wrong, the mistakes happen.
Something gets left behind as many as 2 out of every 10,000 surgeries. If you have unexpected fever, pain, or swelling after surgery, ask if you have a surgical memento buried within. And on my list, air keeps us alive, so how does it kill man? And a mix-up at the maternity ward that leaves moms bonding with the wrong baby. The healthcare harm is stacking up as we count down our 5 shocking medical mistakes. Surgical souvenirs came in at number 15. At number 14, baby switcheroos.
Can you look at this? Oh my God. Wrong baby. Wrong baby.
Like Pam from Monica Garcia is the victim of a baby mix-up. She gives birth to her son Marcelino. In the nursery, he needs to eat. And the hospital worker hands the baby over to a stranger with the same last name. The wrong mother breastfeeds Monica's baby.
So it's hard for me to accept that my child has been with somebody that I won't be around.
I'd like to think that I would know if someone brought me a baby that wasn't mine. You might and you might not. Most babies look pretty similar. They're all kind of just cute little chicken things, and they're not that easy to distinguish. Especially you've only seen them.
So you want to love your other, but confuse one baby for another baby.
A loving mother will love the baby that she's loved. When you're fancying your baby, ask the nurse to match your baby's ID band with yours.
At number 13, bubbles in blood. After weeks in the hospital, 19-year-old Blake Bout is excited to be going home. Before he can leave, Blake has to do just one last thing. Have the central line in his chest removed. While he's sitting upright, a nurse removes the tube and then seals it with gauze.
You could hear popping from this line side, and it was just total sucking, and what it was doing was sucking air right into the.
It's called an air embolism, and that air is killing Blake.
The air was cutting off the blood line to his lungs and to his heart, to his kidneys, and to his brain.
The nurses failed to follow basic rules on removing the central line. Blake should have been lying down, and the nurse should have sealed the hole airtight with Vaseline. This doctor is Blake's mother. She's only a medical student at the time of the mistake and doesn't know how to stop it. She begs the staff to do something, but no one calls her until it's too late.
We went from planning a party to planning a funeral. The most heart-wrenching thing I had to do was to go and tell her that her brother was not coming home. And I just, who knows what's going on?
While there's no national figure, no, a report looking at just one hospital's IU finds improperly removed central lines cause 10 air embolisms a year. If you have a central line in you, ask how you should be positioned when the line comes out. At number 12, misdiagnosed. Morgan McCracken gets socked in the head with a baseball. Mom and Dad, the 7-year-old seems fine until 2 nights later when she cries out for help.
Mom, my head. It's hurting, she's holding it. And my head's hurting, my head's hurting.
The McCrackens rush Morgan to the emergency room.
We couldn't get to the hospital fast enough.
I carried her. She was so lethargic to walk.
The doctor says, don't worry.
I'm sure she's late, she's tired, she had a touch of the foot.
A gut feeling tells these parents the doctor has Morgan's diagnosis wrong.
This little Morgan, she's had the flu before, and this wasn't how she acted.
They ask for a scan of her head, but the doctor won't listen. What is the consequence of the doctor not listening to you?
They are failing to cure the first manifestation of a life threatness, and they're failing to wrestle and therefore look the body for the first clues of that and begin to order right tests.
After hours of begging, the doctor finally does listen and orders the CT scan. Here's what he missed: a blood clot inside Morgan's skull. A surgery saves her life. 1 out of every 10 diagnoses you receive from a doctor may be wrong.
Like Morgan's parents, you should trust your instincts. If a diagnosis doesn't sound right to you, get a second opinion.
At number 11, transfusion confusion. Blake Oliver feels sharp pain in his stomach. He goes to the hospital. He needs surgery and a blood transfusion. The new blood has to match his blood.
Some people are O-type blood, some people are A-type blood, some people are A-type blood. You can't transfuse the different types of blood into each other because your body interprets it as an invading bacteria.
To know Blake's blood type, his blood needs to be drawn and tested. Instead, a mistake is made and all that testing is done on hospital roommate.
The roommate's blood, being A positive, was labeled Blake all over and given to him, transfused.
The A-type blood mixes with Blake's O-type blood.
Cause the blood cells to rupture, and when they rupture, they can clog up your organs, it can cause kidney failure, it's called a hemolytic reaction.
That new blood kills Blake.
It was just the most ridiculous scenario. And it could have been really 100%.
One of every 19,000 units of blood is administered incorrectly.
Know your blood type, so if you're getting blood, you can check the bag to make it match.
At number 10, getting burned. He expects his heart bypass to go smoothly. Monitoring cables are snake through Parame's heart, but the monitor malfunctions and the cables get so hot inside of his heart is cracked. The damage irreparable, and Parame has to get a new heart. Rocky Rockenback also gets burned in the hospital when doctors turn his throat into a blowtorch. Here's how it happens. During surgery, a balloon is inflated in his throat to block anesthesia gases in his lungs from rising up. Surgeon's laser punctures a hole in the balloon. The gases flow into Rocky's throat. Instead of stopping the surgery, the doctor continues. The laser's heat sparks the gases and fire explodes. Now, Rocky has to breathe with a plastic tube. How could a hospital burn a patient in surgery?
These accidents usually occur because of errors that occur in setting up ventilation. Because there's a lot of equipment that involves electricity, that involves some gases, other things that are flammable. These are terrible errors.
240 surgical fires break out every year in U.S. hospitals.
Lasers and cables can generate a lot of heat, so ask if your surgery will use them and how you'll be protected.
Ahead on my list, we all know our left from our right, so how does this boy's surgeon get so confused? And a routine test goes wrong and leaves patients partially bald. We've seen a baby get switched and a patient misdiagnosed, pushing down our list of 25 shocking medical mistakes. Getting burned came in at number 10. At number 9, look-alike tubes. Alicia Coleman is born 3 months premature, a disease all but destroys her intestines. To keep her alive, doctors insert a feeding tube into her stomach and a central line tube into her vein. One day, Alicia's mom drops her off at a medical daycare center and heads to work.
Handed her over on Saturday at 8:17, and I got the call at 9:20 that her medication had been administered wrong.
A central line tube and a feeding tube look a lot alike. The daycare center pumps medicine meant for Alicia's stomach into her vein. The medicine stops this toddler's heart and she dies.
I've never got. But she had to go through it alone, and I wasn't there.
Is it easy to confuse tubes?
We should be very cautious. Unfortunately, people get rushed, people cut corners, and when that happens, tragic things can happen.
16% of doctors and nurses in a survey say tube mix-ups happen at their hospitals. So the lesson here is, when you have tubes in you, ask the staff to trace the tubes back to the point of origin, so the right medicine goes to the right place. At number 8, biopsy blunder. Something unusual turns up in 35-year-old Derry Easton's breast. Is it cancer? Doctors do a biopsy. For diagnosis, positive, invasive lobular carcinoma. This single mom has breast cancer. She gets a second opinion. Two more experts look at her lab work and agree. Derry decides she has to be aggressive to save her life. She has surgery to remove both her breasts. And then weeks later, a bombshell admission by her doctors.
They told me, basically, you didn't have cancer and you never did.
What makes doctors think she's sick? That biopsy showing she has cancer actually belongs to someone else. A health department investigation says a lab technician is most likely working with two specimens at the same time. By mistake, the worker takes a nut's tissue and puts it inside a container labeled with Derry's identification.
Something should have been done to tell me that there wasn't anything wrong with me before I had a radical mastectomy.
You make the diagnosis with biopsy, and for sure there could be a domino or butterfly effect that occurs from taking an initial biopsy, where everybody starts to make a decision based on that initial biopsy or error.
1 out of 1,000 lab specimens is mislabeled. If your surgeon, radiologist, and pathologist don't all agree on your biopsy results, ask if you should repeat the test and another opinion. At number 7, having the wrong baby. Carolyn and Sean Savage want a baby after 4 miscarriages. They turn to a fertility lab for help. The couple thinks their embryos are placed in Carolyn's uterus. Until 10 days later, when the lab calls with unbelievable news.
We were pregnant, but at the time that they had transferred another couple's embryos to Carolyn.
The baby growing inside Carolyn doesn't belong to her. It actually belongs to this woman who has the same last name, Shannon Savage.
I'm thinking this woman has got to be a basket case.
And then find out she's pregnant, oh, by the way, with somebody else's kid.
Here's how the embryos wind up in the wrong womb. To locate where the frozen embryos are stored, a lab worker, by mistake, uses Shannon Savage's paperwork instead of Carolyn Savage's. The worker pulls Shannon's embryos from a cryopreservation tank and places a petri dish with the name Savage on it. 9 months later, knowing she was having someone else's baby, Carolyn gives birth to little Logan and then gives him up to his real parents.
You say hello to everybody? Say hi. Hi.
To think that a woman carried someone else's baby, albeit by accident, to turn and then had to hand that child over to that couple, not cheating her own pregnancy. First of all, she's an amazing woman, and secondly, it's a tragedy.
Happily, Sean and Carolyn recently had twins, Isabella and Reagan, with a surrogate. Mistakes like this are exceedingly rare, but they do happen. 9 months in the wrong mom is no way to have a baby. So if you're getting fertility treatment, make sure the clinic is accredited by the College of American Pathologists. At number 6, Jesse Matlock has a wandering right eye. The 3-year-old needs surgery to have it fixed. He goes in for the operation, and the surgeon puts the eye instead of the right.
My husband and I were in awe. We're like, can you repeat that again? And she said, frankly, I lost sense of direction. I messed up and did this side and then did this side.
Surgeons are supposed to initial or mark the correct side, like they did with Jesse. One way they can still get confused.
We place drapes over the entire area to keep it sterile. Mistakes can be made very rarely. We have draping that obscures the mark.
And 7 patients every day suffer body part mix-ups. Just before surgery, make sure you confirm with the nurse and the surgeon the correct body part inside of your operation, and don't be shy about doing it. At number 5, radical radiation. This isn't a bad haircut, it's the damage done by too much radiation. Michael Moiser goes in for a CT scan of his head. Clumps of hair fall out. Suzanne Sloan, same thing. And same for Donald Biggles.
I had a perfect ring around my head.
Here's how their hair falls out. The hospital's program to CT scan her wrong and repeatedly scan these patients with monster doses of radiation. Michael gets 8 times the allowable dose.
The well-publicized images that we saw of patients who got CT scans of the brain who had hair loss and very poor distribution, that was the area with a lot of repetitive imaging where the doses got up very high. basically the hair cells got destroyed by the radiation.
The fallout from that dangerously hot radiation wasn't just hair loss. Donald, Michael, and Suzanne had to worry that all that radiation could give them cancer. Possible, instead of a CT scan, ultrasound, or an MRI, because they have no radiation at all. Still ahead on my list, Mo and an MRI are a bad combination. And an unbelievably long ER wait costs this toddler her lens. The one call you can make to speed things up during an emergency. We've shown you flukes and blunders counting down to 5 shocking medical mistakes. Radical radiation made our list at number 5. At number 4, infection infestation. Skydiver Josh Nahum parachutes to Earth. The landing goes badly. Josh's leg breaks. His skull fractures. He's on the mend in the hospital when he catches an infection from the hospital.
Nobody ever thinks that they're going to go into a hospital only to be made more ill.
Doctors are powerless to fight the bacteria raging through Josh's body.
What we're seeing now, and it's really concerning, is there's a growing list of gram-negative bacteria that are resistant to many, if not most, antibiotics. And we have no drugs to treat these patients with.
Josh dies at 27. Here's one way infections spread.
One patient may have infection, and a nurse or a doctor is caring for both of them. I go in and I examine them, or I touch them, and my hands get contaminated. I then don't wash my hands and go talk to the second patient or examine the second patient, and I introduce that infection into that second patient. And in many senses, we're no different than a mosquito causing malaria. We're a vector introducing harm rather than protecting patients.
Another way, a needle pierces your skin.
Your skin is an amazing defense against bacteria. But when I break that skin, I allow bacteria to enter.
Hospitals kill 75,000 people a year with these infections. It may be comfortable to ask, but make sure doctors and nurses wash their hands before they touch you, even if they're wearing gloves. At number 3, metal in the MRI room. 6-year-old Michael Colombini has brain cancer. He's getting an MRI.
It is a very large, very, very powerful magnet.
A hospital worker walks into the room carrying a metal oxygen tank. The oxygen tank the worker's hands shoots across the room, strikes Michael in the head, and the little boy dies. Take a look at this video researchers make after Michael's death. It shows how fast that metal oxygen tank kills him. While this mistake is relatively unusual, reports to U.S. Food and Drug Administration reveal additional cases. When you're getting an MRI, make sure there's no metal on or around you. At number 2, the ER waiting game. 2-year-old Lee Jeffers has a 101-degree fever, a bruise on her cheek the size of a marble, trouble walking. Her parents rush her to the emergency room. A nurse says to the family to wait. So they do, for nearly 5 hours. Malia's fever climbs higher. Her bruise gets bigger. She can't even stand up. Mom and Dad ask help again and again, but the hospital says keep waiting until finally Malia's father barrels past. Shameful. A flesh-eating bacteria is rapidly spreading through the toddler's tiny body.
Any break in the skin can occasionally become infected. If you're unlucky enough to be infected by a particularly virulent strain of bacteria, and it gets in your bloodstream, her liver failed, but every other major organ was probably also failing at the same time. They missed the fact that she was desperately ill.
To save Malia's life, doctors have to amputate her entire left hand, fingers on her right, and both her legs.
Is it always obvious first in an emergency room? You can't always tell when someone really needs to be seen. right away, and who can afford it and wait, even if it hurts their bed.
On average, you can expect to wait 49 minutes in the emergency room before a doctor or nurse sees you.
Here's a tip. Doctors listen to other doctors. So when you're on your way to the hospital, call your physician and ask them to call the emergency room so they know you're on your way and it's serious.
Still ahead,
It just goes on and on. You're screaming inside your head.
the most shocking medical mistake on my list.
Seen doctors with dirty hands, a freak MRI accident, and now we're at the end of my list of 25 shocking medical mistakes. The ER waiting game came in at number 2.
And at a shocking number 1, waking up during surgery. You go in, you go under. That's the way surgery is supposed to go. But it doesn't always happen that way.
There was a pain. There was a pain that you cannot deal with.
It just goes on and on. You're screaming inside your head.
They're on the operating table, paralyzed, unable to move or speak. They feel every poke, every prod, every cut.
Just get my gut. Just let me out. Just let me out. Let's say know that this hurts so bad.
Their nightmare is called anesthesia awareness. Under anesthesia, your muscles are paralyzed and your brain is unconscious. But without adequate anesthesia, your brain can stay awake and aware while your muscles stay frozen. An underdose of anesthesia can happen for a lot of reasons. Sometimes it's just a goof. A vaporizer gas tank is disconnected or is empty.
The physician has the vaporizer on, thinking that they're providing anesthesia to the patient, but they really are not. They're undergoing surgery with no anesthesia. Undergoing a surgical procedure with no anesthesia. I mean, that's not defendable.
Anesthesia awareness happens to about 1 out of every 1,000 patients. Most are awake and aware, but not in any pain. When you schedule surgery, ask your surgeon if you need to be asleep, because sometimes numbing just the surgical site could work instead. No good doctor ever means to hurt you. Doctors and nurses and everyone who takes care of us are just like us, human, and make mistakes. Now you can help them get things right. I'm Elizabeth Cohen, and I hope this hour makes you an empowered human.
It's sudden. It's unexpected. It's traumatic. And where you go now may be the difference between life and death.
Funding for the program was provided by Desert Program Partners.
911, what's your emergency? Please stay on the line for the emergency dispatch.
Emergency dispatcher, what's the address or location of the emergency?
Right here, section.
And what are you
I
reporting?
have no idea. We're just... My unit's responding to all the speed limit for the rollover northeast quad.
Speed of this man.
Alright guys, so this is the airway. Okay, so Smith and Allison, you're gonna be running, and then Michael's gonna put on the phone line. Good. And the rest is right here. Here, you have to put it here. And we'll get one.
well, kind of went out on 22 years of people. If you take a patient who's been in a car accident, this is by far the most common mechanism of being really hurt. When you go to a place where you're a trauma center versus a place that's not, you have a better chance of survival, and that's been scientifically shown that the survival rate is increased by 25%.
A trauma center is the last place most people would ever expect to find themselves. Yet trauma injuries will affect 1 out of every 3 people. More people under the age of 44 will die from trauma injury than heart disease, AIDS, better than they once were.
The trauma center is a fairly new concept. It hasn't been around in many ways. If you go back to the ancient times, the doctors were there when you had war and people with stabs and swords and spears and things like that, but they weren't actually a trauma surgeon per se. And if you look at modern medicine, this is a relatively new field. And to have doctors who are surgeons, primarily ready to take care of people who are severely injured, it's been around for maybe about 20, 30 years at the very most.
The changes in the evolving field of trauma care are mostly indistinguishable to the patients. Many never even heard about trauma centers and assume they're being treated at the emergency room, or ER as it's commonly called. Depending on the hospital, many doctors and nurses will work in both the emergency department and the trauma center. However, the distinctions between the ER and the trauma center are numerous, specific, and significant.
If you go into the hospital and you need to go to the emergency room, you have things like medical illnesses where they don't have to have surgery done, such as asthma problems or heart attacks or strokes. Then those will go to the emergency room, and the emergency medicine physicians, their expertise is to, stabilize and triage and then get you to the appropriate specialist if needed. The emergency room is a vital aspect of trauma care, and we work in the emergency. But what we do is that we have a section of the department which is specifically for severe trauma. And for that type of injury, what we've done is we put a surgeon in charge of those severe injuries.
It's a life-threatening, severe bleeding situation. If there's an airway, they're not breathing correctly, if they go unconscious, you need to go to the trauma center. If you cut your finger when you're cooking, you don't need to go to the trauma center. If you trip and fall and maybe break your ankle, you don't necessarily need the trauma center. A lot of emergency departments will have a surgeon on call, but they may have 30 minutes to an hour to respond to that. Ours, we have to be here in-house. We have to have neurosurgery, we have anesthesia in-house, the ORT has to be ready to go. The trauma center is required to have rapid blood supply, rapid infusers, fluid warmers, and all of the resources. Again, it's the human resources that the trauma center is required to have that other emergency departments aren't required to have.
There are thousands of emergency rooms nationwide, but only about 200 level 1 trauma rooms, which provide the most comprehensive care available. They treat the same types of injuries, and nearly all face the same challenges to provide that care. The University of Arizona Medical Center in Tucson is the only level 1 trauma center to serve all of southern Arizona, an area of more than 20,000 square miles that's home to nearly 1.5 million people. Except for those who have been treated at one themselves, Most people learn about trauma centers from the news.
I was shot just seconds after Congresswoman. I was in a lot of pain, and I was very happy when I began to hear those groups on the ground rushing and jumping over us. I was told later that I was lying so still they thought I could die, and so they were rushing to the me. I'd never ridden in an ambulance before, but thought it would be a smooth ride. I remember the radio conversation where they said a 63-year-old woman to GSW, and I asked, what is a GSW? And they paused, there was a slight pause, and they said, quietly, gunshot. I was in a lot of pain, and I was so incredibly grateful that I knew that I was now in a place where I was going to get taken care of. It's gone through my mind many times that the outcome was really been probably much different, certainly for the Congresswoman, if it had been somewhere in a long distance to travel.
The everlasting effect of the January 8th is one of it has been that in the past, trauma systems has not been as orchestrated or as sophisticated as some of the other people, for example, cancer, heart disease, and children. We got a lot of media attention. I think that the media attention was fabulous for our organization and also for my profession nationwide because we had an opportunity to explain to people what we do. My office is really good. But I would say at least once a month we have a mass casting every day. Then we get a whole bunch of people coming to us at once. Like again, the pileups of the car, those are the most common practices.
I think the value of trauma systems, I think we need to relate to any mass casualty. We have now the Boston Marathon incident bombings. They have 9 trauma centers in their community. We've absorbed hundreds of patients. Another bombing in Texas. There's always something happening. People don't have to recognize a lot of these communities have trauma centers, and that's where these people are going. You just don't know when something's going to happen. You think it's brand.
It's the first responders on scene following set protocols who determine the severity of the injuries and whether the patient will be sent to a trauma center. If so, the protocols require the patient to the hospital prior to or during transport.
Paramedics, people in the field who triage you out there and work with you and stabilize you, know through set criteria. If you have been shot or stabbed from a chin to the knee, for example, if they have a missing arm, if they have 3 or 2 long bone fractures, that type of thing. In addition to the fact that physiologically you look bad, you're unconscious, you can't communicate, your blood pressure is bleeding, your heart is really high because of the bleeding. Those are things that cause them, check boxes. Hey, this one is bad. I'm taking them to the trauma center.
Based on the information we receive, trauma centers assign inpatients a code that corresponds to their condition and severity of injuries. This enables the medical staff to have the right personnel and resources ready upon arrival. At University of Arizona Medical Center, green is for the least injured, white is for moderate injuries, and red is for the most severe case.
I think we'll see routine surgery and 10 minutes. Low pressure, testing, that you want to resist.
Yeah, TT 140 over 110. Significant ejection from her. We got one line or 10 in a second.
I think the biggest misconception when I talk to people is all we take care of is criminals and gangbangers and people doing, bad things. And I think they forget about really who our trauma patients and who make them up. They could be your brother, your sister, your mother, your father.
Hey, Shane.
I placed my phone number.
Location of the lower extremity of the knee.
The woman who came to the office and left me 200 shots. And so the message to me was very kind. She just said that he had been in an accident and that he was going to the UMC Trauma Center and that I should go there. He was talking when he came in. He was completely oriented and he was simply complicated. So we were able to get a little information from him, but also watching, the extensively that we could actually see without even having a scan and actually remove it and being delivered. Oh my God, this is it. I just checked that. We weren't there that long, and we were taken into a call and two doctors, and they explained the level of insurance. And then they said we could see him.
We discovered mostly orthopedic injuries, so significant orthopedic injuries, all fractures, both upper extremity as well as on the lower side, first and right. But arterial injury accompanying those fractures are that bad, we were having trouble making those pulses and put